very good day to our precious viewers, wherever you are. This is Denzil Media, and my name is Real a media person and a video director. Of course, today we have another influential personality in our studio, and this person has saved a lot of lives. He has educated a lot, he has inspired a lot, and he is someone that many youth probably might have heard the name. They are wishing to meet and learn a lot from him. Others also see him as a role model. Others see him as an inspiration, judging from the era in which he came from, and till now he's still making waves, acting his name into history books. Today we have Dr. Colombus in our studio here with us. Good day and welcome.
Thank you.
Quick one, just before we get into my details, we would like to know you better. Probably you take us through your upbringing, your life, and then let our viewers know who you are.
Thank you very much. Yes, this Colombus Bondong Bedinye. Lively, I was born 66 years ago. Started education at the nursery 1 to 2, and in 1966 I was then taken to St. Paul's Primary, where I did all my primary education till 72. And 72 I would then move to middle school in those days, now called GSS or whatever it is. Yes, and then come 1975, later I wrote the common entrance and then made my way to London Secondary. There I pursued my course. I did arts. And those days we take about 5 years to complete the O levels and 2 years sixth form. So, in fact, I graduated well in London Sec and finally left the place in 1981. I could not pursue the sixth form, even though I qualified due to financial problems. So I joined the then Eurodebt, worked shortly after with them. Eurodebt in those days, they were dealing with agric. So I made the surveillance. I was the surveillance director in agric, and I was posted back to the then upper West here. Yes, I worked about 5 months and then left the place. So I came back and joined the teaching service in 82. Okay, so from 82, I was kept in the middle school. I started with Basel Middle a year, and then I was then posted back to Tom, which is my village. I would say I wasted all my time, but it was not time wasted. It was a stepping stone. Worked there for more than, I would say, 10 years.
Wow.
Yes, before I could say I would join health. With that knowledge I know. So I was with Jirapa NTC. So I finally completed the NTC in 1995. Sponsored by Nanda Hospital. So I was forced to come back to Nanda. Yes, because that was my sponsoress. Yes, as a nurse, young nurse, I was very, very vibrant. Of course, if you are a nurse in those days, I'm not condemning the nursing today, but our learning and our learning was different. Yes, I must be frank. Because when I sit down and watch them do things, I always feel like vomiting.
Wow.
Yes, I must be frank. So, in fact, I was touted in the nursing services. And there was, when I was in London Hospital, St. Teresa's Hospital, there was no year that I would not get an award due to my hard work. I didn't wait for my in charge to tell me to do this, do that. No. Finally, I became an in charge.
Wow.
Yes,
Impressive.
Yes. 2003, 2002, I was sponsored to go again to do my medical service.
Okay.
So I went. So came out in 2023, and I became a physician assistant. Yes. So I worked as a physician assistant till now. And due to my hard working and knowledge in medicine, I was touted as a doctor. My own director called me professor, the others called me director. And there, well, I did not see any case that bullied me. Yes. There was a time when my director left for further studies and I was left alone. For 6 good months, we never, not a full year, we never had a doctor. So I was made to run the hospital for 6 good months. Luckily on my part, there was no death, no casualty. I never even referred a case to other high places like Dr. Chirapa.
That's nice.
Of course, yes, the team and the upper west in those days used to come to me. How I did it. How did I do it?
Okay.
No doctor announced me. So I don't need to talk much about it. For her, Apia Denzil, the then regional director, who wanted to further my education more, to do medicine, now to go in for at level 400 to start with. But it did not work for me. Of course, yes, I had a lot of challenges, family problems, and my work came in. So I had to drop them and continue as a listener. So, and honestly, the whole of London, if you want, when they are mentioning a doctor, it is me.
Of course.
It is me.
Of course.
I'm not boasting.
We've heard the name growing up.
Yes. Every patient, every person, they know who I am.
Yeah.
And even as I'm my pension is very for me to do, just to see them. If they came to the hospital and did not see me, it means they have not come to hospital. I'm not frank, yes. That was how I was. So I was there, and then 2023 that I existed from the service.
Okay.
So and
Okay.
though tired but not tired. Of course, I would say, should I say, a private lab. I just need to come and take charge of doing this, and I'm doing it. Yes, thank you.
And this will lead me to my next point. Of all the professions in the world, one would want to ask why you decided to be a doctor. Why the health sector?
Yes, health is first. Even if you look at the Bible, if you really read Bible, you see that Jesus came with everything that was possible for him, but it was health that was much stronger than what he was doing.
Definitely.
Yes. So, and he really healed the poor and gave to the well, please make sure everybody become healthy.
Definitely.
And then that is why we are having the World Health Organization. So to me, I felt that yes, I could have still continued with teaching. Even they say teachers, they bring us up. But if we look at it, health first. So I decided to go to health.
In a way, you are still teaching because...
that is it. I don't want to go that way. Because
yes, you are still teaching. People are learning from you. You are
exactly.
People.
If you look at health and then teaching, I don't think we are not running away from teaching.
Definitely.
Yes, because we do public health, and we have to educate the public to be hygienic or keep away from disease.
Definitely.
Yes.
What intrigued me is the fact that during your era, the technology wasn't as common or readily available as today.
Yes.
And you realize that you make mention that at a point in time you took charge of certain operations in the hospital.
Exactly.
You took charge of the hospital for 6 months. Like, from your era to now, you realize that technology has advanced.
Exactly.
How did you evolve yourself from your era to this current generation?
Yes, if we look at things, in those days, nursing, we started with the raw hands. There was no gloves, even common gloves.
Wow.
But if you were determined, you would go through it. Me, as of now, I don't know. I don't even know what gloves are. Yes, but the gloves, when you look at it, is to prevent us from infection. Honestly. But I hardly use gloves so much. And my belief is different from what people may be thinking.
Okay.
Yes, the more you fear infection, the more infection will run after you. Yes, I'm saving somebody. Why should the infection come? So, mine in those days, I was barely using the raw hands and we used to recycle gloves. I would use it and boil it, dry it, and powder it, and could send it to the outlet to sterilize it, which was very tedious. Today, one man, one glove, and you're throwing the things away. Exactly. Now, in those days, the medicine was not advanced. We were still using the raw, what we call it, what you know about your anatomy, and then whatever it is today. You see a lot of gadgets when you enter the theater, and they are monitoring you.
Yes.
So wherever you are going, they is monitoring you and will tell you what. But our days, our time, you must have your anatomy should be sharp as you are sitting. I know the way I know your structure. You should know where those organs are and should be able to avoid them during operations. If not, you will damage or you will kill. That is it. So if you do not have that sense of listener, then you can't do operation. Just forget it and don't attempt. So it's always doing operation that I use gloves. Apart from I don't. You will ever see me working, I don't. And I don't infect people. Once the spirit is there, wash my hands and then sanitize yourself and you are
good to go.
Maybe the person has come in, it is an emergency. Why should you be worrying yourself wearing gloves? Just wash quickly and attend to the patient. And that was my tactics I was using.
Wow.
Yes. And I'll do that, and after that I'll wash. People didn't understand everywhere. So so that is that. So I mean, I even appreciate what is happening now, the new technology that is going on. So it is good that they do it. And there's still something I still don't understand, especially when you get to OPD. As you just mentioned, the technology that is going on. But they are not performing very well.
Wow.
Because you see patients sitting for a long time. Now, if there's, what do you call it? When do they call it what? When, I'm confused. Sometimes you see that all the gadgets are off. They may be out of power outage, or they will say, what do you call it? On our phone is also there, what do you call it?
Is it TikTok?
No. Sometimes you will be doing something and then it will not come again.
Data.
Is that the data? Okay, there's a term for it, not the data, but all right, it's coming. Okay, so it will cut off like that, and the patient will be sitting, and because they are looking forward for the digitalization or whatever it is, it must work out for you to then diagnose a patient. No, it's a waste of time. Or is that the attitude? Though it is good, but we should carry on with the traditional way of doing things. So, on so many occasions, patients died at the OPD. It's today that I'm making noise about it. Yes, I send this thing forward. Told chiefs about it, to talk about it. You can't rely on that and say, and you allow patients to die at OPD. It is very bad. They should not die. No patient should die once they are in the hospital. It is an emergency. Send that patient to the emergency ward and start working on it. We don't need gadgets to do anything. When you do that, then yes, people say you have. You'll see the effort you are putting on. But when you sit down and look at them, allow them to be dying at the OPGs. Oh, no, it's bad.
Good. Well, I'll come back to that aspect. I would like to know more about that side of the healthcare delivery. But you make mention that at the point the doctor in charge left for studies, you were in charge for about 6 months or so.
Yes.
You never recorded any death or something like that. But I know the process of your practices, you probably might have come across a situation whereby you need to relay sad news to a patient. Maybe, I don't know, how do you handle such a situation?
Yes, that's why in your training you do what we call psychology. Or in our part we call it psychiatry. Yes, when I was a nurse or before I was trained as a nurse, you learn all these things.
Okay.
So you have to, prepare the patient psychologically to understand what is going on. So it's there.
Okay.
Yes. And that one alone is treatment by itself. It will treat you psychologically. You don't need medicine. Not every sickness that comes with you give the person medicine. Never. The way you handle the patient is treatment already. Yes. But you have forgotten of your psychological work. Yes. Even at OPD, when the people are sitting like that, don't leave them aloof. Get up and start a health talk there. You see, then they'll be listening to the health talk, and everybody will tune in to what is happening to me. Maybe I did something on this, but that's what. Then you'll be nodding. That's what this thing has been happening to me. You have already treated it. Okay. They don't. Go round and see what's happening at our OPD. You don't like it. The nurse, I don't know whether they were trained or not. I don't know. We shouldn't play politics with them. But unfortunately, the same politics is infiltrating into our health system. And that is too bad.
Wow. In advanced as it is, no, definitely there could be a way of remedying the situation, probably. But that will be for another day. But Doc, I would like you to take me through a difficult medical operation you've ever encountered and what the outcome was.
Unfortunately, let me be frank. That when I mentioned that surgery I did was just we are not allowed as a physician assistant to do major operations. We do the minor ones. But this one I was just assistant, and it was an immediate decision because where that Dr. Mesa even threw away there. Yes. Then this day he packed and went away. So I have to continue with what I saw. And yes, I have to continue. If I have left, then we all in the team there, we are useless. So I exhibited my knowledge in what is anatomy.
That's
right. Honestly, we the physician assistants are not allowed, except that your director may instruct you to do. Because there's no doctor. In fact, Nandam Hospital PC, we were practicing as where there was no doctor. Today, there are doctors. In fact, right from the generation of Nandam Hospital, it was physician, medical assistant that we were doing. Yes, and you might have heard of Dr. Bowen, Dr. Jeffries, and one more. Now, the thing has also endow on me. We are all physician assistants, medical assistants. So unless you are endorsed by the higher authority, the regional higher authority, to do it when there is a necessity. So that was the chance. If not, we don't. Medical assistant, medical dad, we don't do. So I'll not go far with it. But even though I know I'll not go far.
Definitely,
yes,
definitely. Yeah. Let's come back to the current crop of nurses that are being churned out by our institutions. What is that one thing that you think they're not doing right?
And that's one thing I've also mentioned. I've done mention. You see, number one, if I go to the OPD, their duty there, the major duty is to give comfort to the patient. Secondly, health education.
Okay.
And this will give them that the benefit of the doubt that they will be they will be giving healthy treatment. But you go there, you will not like it. Now, just as you mentioned, modern technology, you go and see them with phones here and there, they will not even listen to the patient. They don't know what, and it's terrible. So to me, I'm even making a strong recommendation that no phone at work site. After work, they should then pick their phones. The doctors have the right to, or whoever is in charge at OPG, they make you and in charge of the OPG. Seize every phone down. Let them do their quarantine. Yes. And some of them, as I've seen, I don't know whether they have ever been to the classroom. They can't speak the language, English, not to talk of the professional language. Yes, we have professional language. The nurses' language is there. Okay. Likewise, the doctors, whether they speak it. You go and see them. No. So because of that, they fear to give health talk. Some can't write their names. Just like when we are experiencing the same schools. So we had one before I left. Sorry to mention the person's, because he was, I'll not mention the name, but he said he was the minister's doctor and niece. So finally, look, ask this girl, instruct this girl to do this procedure, he can carry it out. Wow. How did you pass that? When you're speaking English with him, to her rather, she will be talking to you.
So how did she pass out?
That was a question mark. You see, that's what I said, they have infiltrated, dirtied the health sector.
Okay.
Politics. So you tell me that you are a minister's niece. So you went there, you were pushing. So every year they push you to go. Whether you pass your exam or not, they are pushing you. So do you know what? Finally, we have to think of something, arrange and let's transfer her to go. Go, sir. That's where you came from. Go. That is where they speak Twi. Here we don't speak Twi. So you see the challenges that we have. You must know your procedures, nursing procedures. Have talk and all those things. Yes, but they don't.
So, with this, how risky is it?
Very, very risky. That's why I say you are a killer. Yes. And let me give you, there was some, just quite recently, I went into the children's ward. It's about 2-3 months ago. Went into the children's ward. So a child was crying. No, they were trying to pass an infusion. So I stood there, 30 minutes, they could not get the feed. So I approached them, greeted them, and said, "Can I help?" They didn't even look at me. Can I help? Can I help? 4 times. The nurse looked at me, and then the way he squeezed out the face and whatnot and made him laugh and removed the gloves, threw them away, and went and sat. I took my time, collected the tourniquet. When the other one was still standing, I said, okay, what the way I do? As I said, I didn't put gloves. I held it down this way, put the tourniquet around, and I started showing my what anatomy. I said, have you seen a grooving? He said, yes. That's all. That one is. Look for the straight one, not the crooked one. That's all. Then if you go in, bim, it ended. Remove the tourniquet quickly. And you see that what was passing through the distance. When they remove the tourniquet, it was so stop. The movement of the blood will stop. And then you connect your distance. Or just allow it to go to the edge of it and then you then block it. That is all. Afterwards, I went to the table. I blessed her. What was your first this thing that you did? Oh, can you say, oh, who am I? Can you give me my identity? Before I allow you to do. You didn't. You just didn't. You don't know who I am. Even the patients were crying, oh, that this is the daughter, oh, that is the daughter, this is the daughter. But he didn't listen. He didn't know what they were talking. So I blessed him, her rather, and I told her, look, honestly, I've worked in this hospital for 30 good years, whether you were born. Whether you were born, and if you see one of my child, my son, I don't know. Nonsense you. I gave it to her. Well. And said, look, if we do, and I go to the office, maybe expect a letter of what? Maybe dismissal or transfer to anywhere you want. So you see, they don't know anything. I will not also declare themselves that I don't know. Because in our way, if you don't know, consult. That's one funny thing. Especially with these veins and whatnot. You consult. Okay. Yes. Medication self. You see, you give the right drug to the right patient at the right time to the right person. They have forgotten of the 4 hours. It's not everywhere you can juke. You paralyze the person or you kill. And before you collect drug, especially the injectable one, what the doctor has prescribed is what you're going to pick. Look at it. Is that the right drug? Gentamicin. You look at it. Is it written gentamicin? Yes. The dose, they say 40 milligrams. And you collected the medicine. You saw in your medicine it is written 80 milligrams. So you divide it into 2 to give you the 40 milligrams that you give to the patient. But if it's the whole of 80, you draw everything. And then you what? You expel the air. There should not be an air bubble in the syringe. Do they know all these things? These are basic principles of nursing, which they are forgetting everything. It is not nice. That's why I call it they are now players. Yes, because the supervision is poor. The ward in charge is supposed to supervise every nurse that is in the ward there. If you are going to give injection, you go round. When I was on ward in charge, I go when you have to give injection, just simply go and I will just come to the patient, but I'm watching the way you are doing. And when I see that you are doing the right way, I go away. Go to the next person. And that is it. So make sure that everybody knows his or her job. Nice. Every morning, sit with them, talk to them before they start work. Wow. That is what they do.
Impressive. Doc, there is one thing that has been of very much concern through the people of Nando.
Mhm.
And that has to do with the youth who are into the usage of illicit drugs.
Mhm.
And you realize that it has, of late, it has become so rampant that things are not moving on right.
Yeah.
What do you think might be the cause, and how do we solve this menace?
Thank you. You see, at first, when I was still in active service, I used to go on radio. Yes. And talk about drug. Alcohol, through drug. They are all the same.
Mm-hmm.
Yes. I think the message was getting down. But for a long time, no.
You've not heard something like that already?
No. I said the narcotic lady
Mm-hmm.
is
Yes.
talking about it.
Yes.
And that is an excellent of him.
Mm-hmm.
Now, but if we observe our children, these guys, they take it as a pride. If I take alcohol or smoking, we smoking, fine. They feel it's a pride. And they don't know that it is harming them. That is very wrong. Fine. Well, we feel that the law enforcement should come into.
Okay.
They have not seen it yet. That's why they are still misbehaving. Because when you talk, people don't see it until you are inside, sick. Then you come to hospital. When he gets up, he doesn't even believe that it is. You see the problem? Now, with alcohol, it is easy to deal with.
Okay.
Yes, there's that will give it to you and you. But today, I don't know what that they still know. My time, what I've learned about to stop an alcoholic, we give you drug, give you more infusion, and you go, you sign. There's a this that you sign. It on you. When you get on, you send this, you form it and form it. You never go around that way. So, but who's doing it with this? So I call back. I know.
Okay.
Which most people don't know. I even wonder, sorry to say, whether my seniors didn't know.
Mm-hmm.
Yes, that's drug, they can do it. If I can tell you right now.
Mm-hmm.
You see metronidazole, flooding, commonly called flooding. Yes, it can, it will take you off. And before I give to you, I'll put you on distilled line. Distilled water, rather. Distilled water to give you the image. Because that will work on you. You vomit and vomit and vomit and you run away. This is the short thing I will tell you.
Mm-hmm.
So, and our law enforcement should come in.
Mm-hmm.
Enter the market here. You see them sitting carelessly smoking. No arrest. So what you did? But if they had come in to join the battle will be won.
Mm-hmm.
I tell you, the battle will be won. No small guy will. And then we should start even exposing one another.
Mm-hmm.
That's another fact.
Okay.
Because I know you know me, and you know that I take it. Will you report me? You will not. Yes.
Yes. I don't really want to take much of your time because you're just coming back from work and you need to rest and stuff. But before I let you go, your final word, your last word to our viewers before you take leave of us. What do you have to tell our viewers watching us right now? Final words.
Well, viewers, our health delivery system should be your number one priority. When you are sick, please report early. Do not waste time saying what. Today, well, I would say the system is forcing some of you to go for traditional medicine. And I'm not condemning traditional medicine. It depends on the dosage, what you take. But if you overtake it, it becomes a problem. If you take eat wisely, you don't need to go to the hospital. And I'm telling some of you, those who knew me in the past, I recommend the traditional herbs. And one time, if you still remember, a snake biting you on your farm, I told you to take some herbs. In the farm that they are there. I don't know it in English, but I said, on the garden, don't far, you chew it. It will calm down the poison in your medicine before it then come to the hospital. When you take it, you can still farm and then come to the hospital. Yes, it neutralizes the poison, and then you are okay. It can be the worst medicine. Take it. We call it Donvar. Take our woman over what for. And you'll be okay. Then you come to the hospital. So take health to be your priority. Thank you.
Thank you very much, Doc, for your time. It's been a pleasure and it's an honor talking to you one-on-one. We hope to have you another time to talk about other health-related issues, as of when you are free, of course.
Okay.
Yes. We are grateful for your time.
Thank you.
Thank you. Yes, to my lovely viewers, this has been a one-on-one with Dr. Colombus Bondong, and one of the renowned doctors Nandom has produced. Of course, growing up, we've heard the name, and we always want to know who Dr. Colombus is. But today, we have the opportunity to talk to him, and he has taken us through how he transitioned himself from the era to the modern world of technology in terms of health practices and what needs to be done at our various hospitals and clinics to enhance healthcare delivery. And of course, you as a viewer out there, you know what you should do to take good care of yourself. And like he said, make sure you report early if you happen to witness anything abnormal about your body. Report early and seek medical attention. Thank you for your time. My name is Denzil Media, a media person and a video director as well. This will be it for today. Of course, we'll come back another time. Thank you very much. Have a wonderful day.
Thank you.